This segment of CoastLife is sponsored by Dover Behavioral Health.
Mental health is such an important topic, and maybe even more important when we're talking about it in relation to young people. Kendall Gordon, our field correspondent, is out today talking to Dover Behavioral Health.
Mental health is something that touches every family in some way. And here in Sussex County, there's a place focused on helping children and teens find their way back to balance. Dover Behavioral Health has been around for decades, growing from a small start in Dover into a statewide resource for mental wellness. I sat down with CEO Karen Fitzhugh to learn more.
Interestingly, Dover Behavioral Health actually used to be a part of the Bay Health System way back in the day. It's actually started in 1996 and was called St. John's Behavioral Health Center, and that's the facility that we have up in Dover. And it was acquired by UHS, Universal Health Services, in 2007. And the hospital, when it was acquired, started out with 32 beds, was 52 beds when it was acquired. And now it's a 104-bed acute care psychiatric hospital up in Dover.
One of those communities is right here in Georgetown. This location has been serving families quietly for years, even though many locals don't realize it's here.
This is right on South Bedford Road in a nice serene area, and one of those areas that people, I don't know, are all that familiar with. And yet we've been here in this location for about 10 years.
The need here is growing, especially for kids and teens still trying to regain a sense of normal after the pandemic.
And so we are helping kids now really figure out how to form relationships with one another and to disengage really from electronics and the internet and social media, which is of course a very big problem.
And sometimes the signs that a child is struggling can be easy to miss.
One of the things that you see with children who are really beginning to struggle is a pretty significant shift in the change in their mood. And be things like being much more irritable, or clearly sad, or clearly anxious. So we see these things that would also include changes in sleep patterns. They're either really sleeping a lot, or they're not sleeping at all, or their sleep pattern is really wavering. The other thing you'll see with kids is a loss in enjoyment of things that they used to really love to do, like kids will quit going to sports, or if they're really love to sing and dance, you're going to see them sort of withdrawing and backing away from that, or being really irritable if they're asked to do something that they have done really well for a long time and they simply can't do anymore.
Karen says when that happens, the best thing parents can do is keep the conversation open.
The most impactful thing that parents, caregivers, and teachers can do is to listen. And it's really important that we look at somebody and we don't say, "What's wrong with you?" And giving a child the space to be able to tell you what's going on.
Access to mental health care in Sussex County can still be a challenge, which makes early support even more important.
We have a significant issue in Delaware as a whole, but most particularly in Sussex County, very specifically for behavioral health care providers. There are very few. They're very difficult to access, and the few that are here are exceptionally busy. And that is one of the reasons why it's so important to be able to know when you have someone in your family, child, adolescent, young adult, who you see struggling, and be able to start looking out for places where they can access help.
The Georgetown site also offers something called partial hospitalization, a program that helps kids stay grounded in both treatment and home life.
It really focuses on the challenges that children and adolescents have, and it also helps parents with the tools that they need, because you're practicing in a real life at home, which when you're in an acute care setting, obviously you're learning how to function in that setting. And in an traditional outpatient setting, which is only maybe 1 hour a week, you have all those other hours in the week that you have to wait before you get somewhere, before someone can tell you, did I get it or didn't I get it?
Karen also wants families to know that mental health isn't something to be ashamed of, because it's just as real as any physical illness.
We're talking about the brain. The brain is another organ in the body. We have a tendency to say, oh, just get over it. What's wrong with you? Pull your socks up, get your act together. And yet what we're dealing with is brain dysfunction. If you don't have enough of the neurotransmitter that helps you to think and respond appropriately, your brain doesn't work. If I have too much or not enough, then I need to either put something in or take something away, and that's exactly what medication does. So it's really two locuses that we need to focus on, both the behavioral piece as well as the medical piece, and that's where we really have the most profound difference and the best outcome.
And if reaching out for help feels scary, that's normal too.
It takes guts to reach out for help. So I would say, no, you're not alone. Guarantee you, if you talk to your friend or your neighbor and you give yourself permission to have the courage to do that, you will find that almost everybody you know is struggling in the same way. And almost everybody you know is either A, afraid to reach out for care, or B, has done so but doesn't tell you for fear of feeling different or singled out.
So if you're interested in learning more,
so we are both up in Dover at Dover Behavioral Health System in Dover, and we're at 725 Horse Pond Road in Dover, and here in Georgetown at our outpatient clinic, we're at 404 South Bedford Street in Georgetown, and we are here to help you.
From Dover to Georgetown, Dover Behavioral Health System is breaking stigmas and bringing help closer to home. Because when our kids thrive, our communities do too.
CoastLife, did you know that 68% of children have a diagnosable mental health disorder? Follow-up question, did you know that only 4% of those children receive treatment? I know, it's insane. So between real conversation and resources, Dover Behavioral Health is making sure that children and teens get the support that they need. Stick around, there's more CoastLife on the way.